Ok. Entonces, este primer módulo va a ser la introducción del doctor Ronaldo Hueb Enrique Lee. Es médico radiólogo de la Universidad de Sao Paulo, especialista en imágenes abdominal y torácica en Harvard University, profesor de la Universidad del Programa de Radiología del Hospital Israelita Albert Einstein de Brasil, quien nos dará la introducción del conferencista de la tarde, que es el doctor Enrique Lee, licenciado en Medicina de la Universidad de Campinas, UNICAP. Pertenece al Grupo de Investigación e Innovación del Departamento de Imagenología y es consultor de análisis médico en el Banco Imágenes PROADI del Hospital Israelita. Y hoy tenemos la conferencia Innovación en radiología brasileña a lo largo de los años.
Thank you. I think first I will share a video from Dr. Ronaldo. I think here.
Olá, meu nome é Ronaldo Baroni, sou médico radiologista do Einstein Hospital Israelita, gerente médico do Centro de Ensino em Imagem do Einstein, em São Paulo, Brasil. É um prazer falar para vocês sobre o nosso Centro de Ensino em Imagem como uma oportunidade de treinamento internacional. Eu vou compartilhar agora com vocês uma apresentação sobre como nós somos estruturados aqui no Einstein. Nós temos 25 anos de história em treinamento em imagem, que começou em 1999, com um único fellow, R4 geral. Depois tivemos pós-graduações em biomedicina, residência médica, que iniciou-se em 2007 com 3 alunos, e agora temos mais de 102 residentes graduados, vários deles trabalhando conosco. Um simpósio multiprofissional internacional de medicina diagnóstica, curso de medicina na graduação, onde a radiologia participa ativamente em diversos anos da formação do aluno de medicina, pós-graduação Estado da Arte, que são cursos híbridos, em formato online, preferencialmente, e alguns encontros presenciais. Já tivemos mais de 400 alunos graduados em várias áreas do diagnóstico por imagem, um centro de treinamento em ultrassonografia, e atualmente estamos internacionalizando nossa atuação, como é o caso dessa apresentação que estou fazendo para vocês. Na unidade Vila Mariana, nós temos o Centro de Ensino de Ultrassonografia, uma das unidades do Einstein, com 8 salas com equipamentos de última geração. Temos na unidade Paulista uma sala com treinamento, com hands-on, em imagens DICOM de tomografia e ressonância, onde acontecem 6 dos nossos cursos de pós-graduação Estado da Arte. A unidade Morumbi, onde nós temos treinamento em ultrassonografia, onde estão as nossas atividades assistenciais, e o Centro de Ensino e Pesquisa, um prédio icônico, aqui próximo à unidade Morumbi, onde está a Faculdade de Medicina e toda a área de ensino e pesquisa. A radiologia do Einstein participa ativamente de congressos nacionais e internacionais, com a submissão de trabalhos científicos, por exemplo, na Jornada Paulista de Radiologia, maior congresso brasileiro de imagem, nós mantemos um nível altíssimo de trabalhos aprovados e apresentados. Neste ano de 2025 foram 89 trabalhos. No Congresso Brasileiro de Radiologia, que acabou de acontecer em Curitiba, nesta semana passada, tivemos 95 trabalhos apresentados. E no RSNA, ao longo dos anos, temos um número crescente de trabalhos, chegando a 65 trabalhos no RSNA deste ano de 2025. Nossa residência médica tem classificação A pelo Colégio Brasileiro de Radiologia. Temos pós-graduações nível R4 e R5 presenciais com mais de 30 alunos por ano. E a nossa pós-graduação Estado da Arte, como eu falei, voltada para o público médico e multiprofissional, com mais de 100 alunos por ano em formato presencial, em alguns encontros e preferencialmente online. Além disso, temos cursos de imersão e cursos de curta duração em raio-x, tomografia, ressonância e ultrassonografia. Lembrando que as pós-graduações, como eu disse, Estado da Arte tem formato flexível, o aluno escolhe se ele quer vir online ou presencial, salvo alguns poucos encontros obrigatoriamente presenciais. E nós temos atividades centradas nos finais de semana, de março a fevereiro, focadas principalmente num treinamento prático hands-on, aulas ao vivo em formato síncrono, participação nas reuniões multidisciplinares do setor de imagem do Einstein Hospital Israelita, reuniões individuais ou em grupo de mentoria e prática presencial ao longo de 1 ou 2 semanas na unidade Morumbi. São 7 pós-graduações no geral, sendo 6 delas médicas. As pós-graduações médicas são Estado da Arte, Tomo e Ressonância Geral com mentoria, Estado da Arte em Neuroradiologia e Cabeça e Pescoço, Estado da Arte em Imagem Músculo-Esquelética, Estado da Arte Abdominal com foco em Tomo e Ressonância, Estado da Arte em Ultrassonografia Doppler Vascular e Estado da Arte em Ultrassonografia Geral Avançada. Para este foco internacional e público da América Latina, nós focamos em algumas pós-graduações que terão atividades também em língua espanhola ou tradução para o inglês ou um formato multilingüe. Isso será a pós-graduação Estado da Arte em Imagem Abdominal, de março de 26 a fevereiro de 27, como eu falei, uma semana presencial na unidade Morumbi, aberta para o público latino-americano, acesso às reuniões do departamento de imagem e treinamento em workstation nas atividades online hands-on que acontecem com o uso do nosso PACS online. Além disso, teremos uma imagem hepatobílio pancreática e gastrointestinal, focando dentro desse curso, imagem ginecológica, urológica e vascular. Então, é um curso muito completo de pós-graduação abdominal, com foco em todas essas sub-áreas. Esse curso é coordenado por mim, além da Cássia Tridente e o Fernando Morbeck, e pela primeira vez no ano de 2026, aberto para o público de língua espanhola. Temos também 2 cursos de curta duração focados no público de língua espanhola, imersão em diagnóstico por imagem e hands-on de neuroradiologia com protocolo AVC, aqui os QR Codes que vocês podem acessar. Isso conclui a nossa apresentação do Centro de Ensino em Imagem, que faz parte do Einstein Hospital Israelita. Muito obrigado pela atenção de vocês e sempre estaremos à disposição para fazer treinamentos internacionais. Até logo.
Okay, now I'll start my presentation. Let me just see if everyone's here. Okay, sorry, first time using this platform. So first of all, I'd like to thank you for inviting me to talk about innovation in Brazilian radiology over the years. I'm Enrique Lee. I'm a radiologist. I work in projects for development or deploy of artificial intelligence in radiology department, basically bridging the gap between the radiology department and the innovation one. So I'd like to start by giving you some context about Brazil. I know that you know my country, but allow me to share some numbers to give you some context from my presentation. So Brazil is the 5th largest country and also the 9th largest economy in the world, with more than 200 million inhabitants, which make it a very favorable environment for innovation, companies based on with technology and other sectors as well. And here you can see the numbers of startups founded over the last decade. You see a growth. It's until 2019, just before the pandemic hits. And here in the gray bar are the health tech ecosystem. The red one are the numbers from the health techs that focus on AI. And you can see a huge increase until 2019. I would say mainly because you have a more mature level of deep learning and natural language processing models. Of course, in addition to that, you have cloud computing being more readily available throughout the place, and also more better frameworks to work with this large amount of data, namely TensorFlow and PyTorch. And after the pandemic, you can see like a decrease in the number of startups being founded. Some would say that it's because of the health ecosystem in general. I would say for me, looking from a different perspective, I would say it's mainly because this ecosystem that was built before 2020, they got grow more mature, so it became more difficult for newer companies or newer startups to grow and go against the existing ones. And in Latin America, we have over 19,000 startups, and over 60% of them are in Brazil, according to Distro, the source of this information. And of course, some of these can be explained by the, the large size of the country, but I would say that maybe it's because we have some structural and institutional peculiarities. For instance, we have here the national healthcare system, the SUS, the universal healthcare system, that is free and available for every person within Brazilian borders. So here in our overall health ecosystem, you have one side the public healthcare system, which is free and are more focused on cutting costs and improving efficiency. On the other side, you have the partner environment, the private practice, which are more focused on improving quality and getting a better level of service to provide. And of course, you have some public-private partnerships, which make this a little more complicated. But it also means that it is a very rich environment to startups, because there are a lot of problems that they can try to solve. You can see here on the right, you can see here on the right, most of the startups, the type of startups that we see more are focused on management and electronic medical record, healthcare access, and telemedicine, which is obvious because I think the primary challenge that we have to face is really access. But right after that, we have here AI in big data and diagnostic, which involves radiology. And why all these numbers are very important to radiology? Mainly because of this. According to ANS, which is the National Agency for Healthcare, they say that for each patient that goes to the hospital, 2/3 of them goes to do some examination. Of course, not only imaging exams, but probably a large amount of those visits are based on exams. And we all know that exams nowadays is a very important source of income for any hospital. So this is the basic background when I talk about innovation in Brazil. But I think I would like to explore more how we, as Einstein Hospital, managed to be one of the most innovative hospitals in Latin America. So Einstein is a non-for-profit organization founded in 1971. It comprises, actually I have to update that, it's 10 hospitals, which 2 of them are private, one in São Paulo, the one that I'm right now, and the other one is in Goiânia, another state. Einstein have this vision of helping transform healthcare across Brazil based on 4 pillars. The first one is excellence in care. The second one, teaching and education. The third, research and innovation. And finally, commitment to public health. So how did we start? So basically, in the early 2000s, we decided to go paperless here in the hospital. So no more handwritten prescription, no more handwritten medical records. We decided to implement like an electronic one, and also a PEX system, basically moving all the data to a more structured way, and which led us to improve our level of care to our patients, and also give us a different environment to work with. And this was very important, mainly because we managed to build a lot of high quality data, which led us to further hire data analysts, data scientists, to experiment and understand those kind of data, this digital data. And that was very important because it was the cornerstone for our knowledge, and ultimately ended in some recognitions. For instance, in 2017, Einstein team got first place in a AI challenge to detect prostate cancer from MRI. And it was very interesting because it led to some important partnership to the to the industry, and also was the first patent that Einstein got. The first innovation department patent was from the radiology department. So we're very proud of that. So throughout the years, we also developed other solutions. The first one for leg length measurement, the other one for bone age, and the third one for thoracic aorta aneurysm. All of them were integrated into our PEX system, making easier for our radiologists to read those kind of exams. But one time we decided that we should not try to develop everything from in-house, namely because it requires a lot of resource, investment, a lot of time, and since we are primarily a hospital to take care of the patients, it would make more sense to focus our energy maybe in providing care. So the one step that we decided to take is really reach out to the companies or go look for commercially available AI solutions instead of just trying to build all of them. After some time, it got a little difficult to manage of all of them. So now we're exploring also some marketplace which aggregate a lot of these solutions. And now we live it like in a hybrid environment where you have some direct contact with some companies, others are through this marketplace, which it's very interesting for our department. And of course, each case we decide to move to one way or the other depending on the problem that we're trying to solve, depending on the solution and the company as well. So to sum up, we decided to achieve like this innovation here at Einstein. We went first to modernize our systems, to go paperless, to adopt an electronic medical record, a PEX system, and after that, we decided to implement AI to help us, to help our radiologists and physicians in the ER, for instance, to get better information from each exam. We also can use AI to do some kind of triage in our exam. So here we can implement some of them to do work list prioritization. So you don't even need to open the exam to know if there's a chance or not to have a abnormality in that exam, and it helps to prioritize the exam that needs to be read first. Also, another thing that AI can help us is with different solution that can do some quantification. for instance, brain volumetry, which is a test that is very time consuming and very difficult for a human to do, but it takes only a few minutes to a computer. And when we talk about innovation, of course, there's a lot of things that we must keep in mind: workflow, data quality, compliance, regulation, etc. And many ask me, "Oh, Henrique, how can you handle that all by yourself?" The answer is very simple. I don't do that by myself. I have a team with me, and it's a very diverse team. I think this is very important to achieve that kind of um, quality. So we have radiologists looking for these solutions. We have the innovation team uh, that is that works with our hub, the Arts Bio, the startup incubator, and also some people from the IT team as well. The idea of gathering all these people is really to make a more orchestrated workflow. People usually ask me which kind of solution or which kind of technology they should invest first so they can modernize their hospital or clinic or institution. I usually say, first, you need to really invest in your team, the people behind the everyday tasks. So only after that you can think about technology, the solution in general. Okay, all of that was only based on our private practice, but I also like to take this chance to talk a little bit about the public scenario. So here in Brazil last year, the health ministry, they proposed this policy that is called AI for everyone well-being. It's a plan to foster innovation and the development of AI across Brazil. The idea is really to develop some models that are very secure, very useful, can be used in a responsible way, widely available in our country, and mainly it is designed for our patients, it's for our populations, for our patients. So as I mentioned, SUS is the healthcare system, public healthcare system in Brazil. It's called the Universal Healthcare System, and they, for some time, they already had some programs that called PROAD. There are some programs fostered by the health ministry. It's a public-private partnership between the health ministry and 5 or 6 biggest hospitals in Brazil, Einstein being one of them. And the idea is to really use the knowledge of these big hospitals to help to develop healthcare in the public system. So here at Einstein, I work, as mentioned, in this project called Banco de Imagens. In English, it's Imaging Bank, in which we are developing 3 different algorithms. One for brain volumetry using head CT, the second one for chest X-ray to detect tuberculosis and also different pathologies in the chest X-ray, and the last one is for screening skin cancer using photos from smartphones or even from dermatoscopy. And what is the idea of this project system? Let me see if I can play this. No. So the idea is to make partnership with different hospitals, institutions across Brazil, gather all this data in this VNA that we are developing in-house. So we can gather specific data from our population, develop research, do some research, develop some models, and deploy them as a service to any hospital in Brazil. in order to give like the physician, that is the primary care physician, for instance, information from the report, the imaging, and also from an AI. And here an example of how we're developing some of those AIs. So one of the major, most important step is annotation. So here it's an example of segmentation of the brain, the intracranial volume. If this is a software called 3D Slicer, it's an open source, freely available software that can help you to segment images, but unfortunately it's not very user friendly. So the idea here is we developed an extension, an add-on that helps the segmenters to streamline their workflow. So basically they need to only open image, segment, and maybe if they want to do some observation right there, that space, they can also track their volume. And if they have any questions, they're not very certain about their segmentation, they can ask for feedback. So this is another advantage of using this extension. So here the person segmented was supposed to segment the lateral ventricles, but has some questions. I wasn't very sure about that. Usually this person, it's not a radiologist, it's usually somebody that works with, it's a healthcare provider, but it's not exactly a radiologist. So after that, the segment part, a specialist, the radiologist can validate those segmentations. We call it masks. So here, for instance, again, he doesn't need to open any different programs. It's all web-based. It's simply open an image, evaluating, spotting a problem here. So here he can see that the brain was fine, but there was some questions regarding the lateral ventricle segmentation. So he can accept the image and the brain, saying, okay, these two are fine, the image is good, has good quality, the brain, the intracranial volume is fine, but here we have some observations. So some parts don't belong to lateral ventricles. So the segmenter needs to revisit that. So when he clicks next image, this image go back to the first person. Just need to open image. It automatically loads, and they get their feedback. So the same feedback the specialist gave in the first place. So here the person can correct what was wrong, and just to make sure here. So you can compare the first version and the second one, making this process very, very easy. So basically that's my presentation. Once again, I'd like to thank you for inviting me, and I'm open to questions.
Thank you very much for your excellent lecture, and I wait for the question after finish all the lectures. Thank you very much. Okay.